So really, first and foremost, the program has been completely restructured by Dr. Oyashiku. There is a whole new group of faculty, all areas of neurosurgery really being covered. The structural changes really have been focused on the residents. The entire reason we changed everything was to enhance the resident experience, the resident education, and prepare them to be leaders in the field. That's our vision, that's our hope. We view the residents as our legacy. And so the clinical changes, getting them into the operating room early from day one, scrubbing with their senior residents and the attending, getting instruction that's appropriate to their level, then expanding as the years go by, more and more graduated responsibility until it culminates in the chief year where they're essentially the instructor. So from the clinical standpoint in the operating room, those have been the main changes. Structurally, in terms of the service, the focus on less service for the workload and the patient care, but more so on educational aspects of it. The structure of the residency has been changed into teams with multiple residents on each team, focused on a subspecialty area and spending a good longitudinal period where there's 6 months before they move on to something else. In that time period, you really can learn the basics and start to mature that area of your training.
So recently, Dr. David has become our program director, and I think that he has a lot of great ideas on how to elevate our resident experience. He really cares about residents, and it really shows. He started these weekly didactics that I decided to call David Didactics, that every week on Wednesday afternoons he sits down with all the residents and we go over cases, or we do something called professor rounds where we present an unknown case and everyone else has to walk through it. A lot of anatomy is discussed. And those have just been, really valuable, just sitting down with him every week. And then, he's very involved in the skills lab as well. And so I think, Dr. David is just, really formalizing a lot of our educational experience here at UNC, and I think it's only going to improve our experience overall.
So we have a state-of-the-art skills lab, multiple stations with microscopes, equipment from the operating room, really allows for very advanced dissection and practicing of surgical techniques and different approaches and exposures. And we've created a curriculum for it where monthly we start with the fundamentals, tissue handling, how to sew, how to open. We'll then work our way through all the various approaches that are used in neurosurgery, the routine versus the skull base, and really dive in. And each resident basically is teamed up with their co-resident from their year, and they each get a cadaver head. And that will be their head through their entire residency, and they can refer back to it anytime they need to review something and work through it along the years. In addition, the spine faculty have now started to create a spine curriculum with the same type of idea, bringing in different types of instrumentation, technology that the residents can get exposed to in the lab.
So it's a really great experience to have another chance to practice and learn the anatomy outside the operating room. In addition to the cranial labs we also have throughout the year at least 2 or 3 spine labs where similar type thing, but usually they're industry sponsored, so we get to practice kind of with some of the new technology out there. Maybe learn some spine techniques that aren't as common in the operating room.
It's a very well-balanced program, so the opportunities are everywhere you look in terms of the clinical experience is outstanding. I'll come out feeling very comfortable with where I am from a technical and surgical perspective. And at the same time, there's UNC as a campus is full of research opportunities. It's one of the biggest research institutions in the country. So those opportunities are there, and at the same time, the program really values a balance. And so I'm married and I have 2 kids at home and another one on the way, and that's allowed me to grow outside of the hospital as well and not give up, on all the things that I value outside of work.
One of the nice things about second year is that we're doing a lot of spine and trauma, and that's kind of foundational skills. So once you get into third year and you're doing more cranial, you have a bigger skill set. So I think that the way we build from year to year helps that down the road, you're going to come to fourth, fifth year and you're going to have a great skill set and you're going to have seen a lot of different cases to know what you want to do during your research year and what you might want to seek out during that year to either go do away rotations or do research in that area. So by sixth and seventh year, you definitely have an idea in mind what you want to do, and you're already looking at fellowships.
Our program, again, focus on the education, first and foremost, making them competent, highly skilled neurosurgeons. That's our major goal. Apart from that, we want them to have a culture of inquisitiveness, asking questions, getting involved in research projects. Several of our faculty have multi-million-dollar grants. They're studying various aspects from movement disorders, epilepsy, to brain tumors. And there's ample opportunities for the residents not only to get involved in those projects, but to learn the process of how you ask a question, how do you design the experiment, proceed with developing a research region. How do you get grants? How do you apply for grants? Follow through on the after grant aspect of it. And so we've kind of created this curriculum where that allows them to grow in that direction apart from clinical neurosurgery.
I think what's made my research successful here is the collaborations I've been able to make with other people at the university. For example, with focus ultrasound, not only takes a neurosurgeon, but a movement disorder neurologist. So being able to have those resources in terms of writing grants or thinking of ideas, submitting publications, to be able to have that collaboration with other specialties, and just those connections that I've been able to get from my mentors has been instrumental.
We really do have support in our research interests and career interests pretty early on with our attendings from a research perspective. And then, when I'm thinking kind of long-term, my long-term goal is ultimately to be involved in clinical trials and have that connection with kind of advancing clinical outcomes, but also being more clinically based, providing specimens and things like that.
One of the amazing things that Dr. Yashiku did when he came to this program is that, he really wanted to invest in a media team, not only for, the program and for marketing, but also to help guide us throughout our research. And so having that resource at our hands has been invaluable. I know it's something that we've all been really excited about and excited to collaborate with them, and so far it's been incredible.
This program, it's very much so graduated autonomy. So I think we start with the foundations as a junior resident, intern, second year, where you're focused very heavily on just the clinical management of neurosurgical patients. And then as you get a little more senior, you start getting more autonomy in the operating room, you start spending more time in the operating room. And then as a sixth year, you're really starting to just refine your skills and get your reps in. I would say that as a program, I feel very comfortable at this point doing spine surgery, which is what I'm on right now. And the fact that I have a year and a half left still just makes me even more confident that I'll further develop those skills and be a very, not only a competent surgeon, but also a safe surgeon when I finish up.
The faculty at UNC today is a completely new faculty. Essentially, Dr. Yashiku brings his experiences from Emory University, which is a world-renowned center, and he has grown a department with faculty from all over, different training backgrounds, different lineages, different skills and areas of expertise. And he's really created a diverse group that brings ideas from all over. And I think that's very important. One of the things I always like to tell residents is that stagnation is the enemy of progress. And I think the rich ideas that come from different training backgrounds, different lineages of neurosurgery really provides the residents with an excellent opportunity for learning.